Let's talk about some safe and simple exercises that you can do during your pregnancy to help support your body, not just for delivery, but for your long-term pelvic health. Hey everyone, Dr. Nabila Noor, board certified and fellowship trained urogynecologist and a pelvic reconstructive surgeon. Welcome back to the channel. If you're new and you like what you see, don't forget to subscribe and share it with a friend. Today's topic is one of the most commonly requested topics that I get from my patients all across the globe, even family members and friends. Pregnancy is a time in our life that we all cherish, but it also comes with a lot of anxiety, a lot of fear of doing something that may hurt the baby or cause trouble or cause complications in our pregnancy. Especially as it relates to your pelvic health, pregnancy does change your balance, your core, your pelvic floor support. So by staying active throughout your pregnancy, you can actually help support your pelvic floor, sleep better, reduce things like back pain, feeling tired all the time, and in the long term, reduce pelvic floor issues such as incontinence and pelvic organ prolapse. Let me share a story about one of my patients I recently saw in the office. So this patient of mine is a fairly healthy 32-year-old who was pretty active before she became pregnant. However, after her second trimester, which is usually around 6 months of pregnancy, she pretty much stopped doing any kind of physical activities. And the reason? She was worried she's going to hurt her baby. Unfortunately, she has had some family members as well as some close friends who has had some complications in their pregnancies, and so my poor patient was convinced that if she does anything remotely physically active, she's going to hurt her baby and have complications in her pregnancy as well. But did that really help her? Instead of feeling better, my patient started noticing she was having more back pain, she was just feeling tired, she was not being able to sleep properly, and in fact, she also started suffering with pretty bad constipation. By the time she came to see me, she was desperate to get some answers and feel better again. So I walked her through 5 movements that she started doing to help engage her pelvic floor muscles and improve her pelvic floor and core strength. These are simple exercises that I'm going to be teaching you today, so make sure you stay here for the whole video so you can learn them, you can modify them according to your trimesters, so you can feel the best version of yourself for your particular pregnancy. Most of these exercises are very simple, and so most women with low-risk pregnancies should be able to do them pretty safely. But if you have any concerns, always a good idea to run them by your OBGYN to make sure they give you the clearance, especially those of you who may have high-risk pregnancies. Make sure to talk to your OBGYN before engaging in any kind of new exercises or new activities. So let's get started. So the first exercises is what we call diaphragmatic breathing, aka belly breathing. Very simple and very straightforward, and in fact, you can do it with me right now. So take a deep breath slowly with your nose, and make sure as you breathe in, you're expanding your belly, and then you're going to exhale through your mouth. Again, breathe in slowly and deeply through your nose, expand your belly, and then breathe out through your mouth. And as you're doing these breathing exercises, make sure to engage your pelvic floor. And what that means is, imagine you're just sucking your pelvic floor muscles inside as you're breathing in. Sometimes, I'll tell my patients, imagine you're trying to squeeze in a blueberry or a marble into your vaginal wall using your pelvic floor muscles. So you're almost pulling everything. A lot of people may know this is the same sensation as if you're doing your Kegel exercises, but when you combine the breathing exercises along with engaging your pelvic floor muscles, the two together can do wonders, not just for your core, but for your pelvic health, and also cause a lot of relaxation, reduce anxiety, and prepare you well for labor. I would recommend doing 10 repetitions about 1 to 2 times during the day. Again, remember, inhale slowly through your nose, engage your core, expand your belly, and then breathe out through your mouth. The next exercise is one of my favorites called cat and cow position or pelvic tilts. Those of you who do yoga may be already familiar with this. So you start with your hands and your knees flat on the floor. Make sure you're comfortable, you're balanced, And you're going to start inhaling, which is breathing in. And as you breathe in, you let your belly drop, almost mimicking the position of a cow. And then afterwards, you're going to exhale. And as you exhale, you round up your back, almost looking like a cat. Do about 10 of these repetitions of cat and cow positions, about 1 to 2 times during the day. Why does it matter? You'll know the difference as soon as you do it. The stretch that it causes your spine actually helps ease any low back pain, any kind of stiffness that you may have in the back, and it's actually a very relaxing posture because it helps improve mobility as the uterus grows. I remember when I was pregnant with both my children, I used to love doing these exercises, especially at the end of a long day. Of course, as a surgeon, I'm operating, I'm seeing patients, I'm running around all the time. So by the time I would get home from work, just doing 10 of these cat-cow poses really helped stretch my back and really helped me relax before going to bed at night. The next set of exercises are modified squats. Modified because you can do it with the help of a chair or the wall for extra support. So you're going to start with your legs or feet, hips width apart, slightly pointed out, your knees slightly pointed out, and you're going to slowly sink down as if sitting on a chair as far back as you can go comfortably and stay balanced. And like I said, you can use a chair or the wall to help support yourself and feel balanced. How does it help? It helps because it builds the strength of your glutes and your thigh muscles, and it also helps engage your core and your pelvic floor muscles and preparing your body for labor. I would recommend about 8 to 10 squats 1 to 2 times during the day. Again, remember, very important, make sure to keep your balance and go down only as far as you feel comfortable, and everybody's different. Number 4 is side laying leg lifts. So you're going to start with laying on your side, hips stacked up, and slowly lift the top leg. You can use a pillow under your arms or under your head or even under your belly for extra comfort. And what this particular exercise does is it helps stabilize your hips. It can improve circulation, especially helpful in the 2nd and 3rd trimester. Again, do about 8 to 10 repetitions of each leg, about 1 to 2 times throughout the day. And finally, number 5, pelvic floor exercises or Kegel exercises. Of course, as a urogynecologist, I'm always recommending Kegels for my patients, but one of the misconceptions about Kegels is people only think they can do it in their postpartum period. But that's definitely not the case. You can do Kegels safely even while pregnant. And in fact, doing Kegel exercises during your pregnancy can help engage your pelvic floor muscles and help start making them stronger even before there's been trauma from the birthing procedure. I usually recommend my patients think about Kegel exercises as a 3-step process. There is the contraction where you're tightening your pelvic floor muscles, and then you're holding it for a few seconds, and then you're relaxing it. So contract, hold, and then relax. They're all equally important because if you miss one step, then you may not get the full benefit from doing these Kegel exercises. Sometimes it can be difficult to understand whether or not you're doing your Kegel exercises properly. So what I usually tell patients is imagine you really need to run to the bathroom, but there's no bathroom in sight, and you're really tightening those pelvic floor muscles to make sure you don't have an accident. That feeling that you get when you're tightening those vaginal muscles, that's what you should be feeling when you're doing your Kegel exercises right. So again, when you're contracting those muscles, you're tightening those vaginal muscles, you're holding it for about 3 to 5 seconds, and then you're relaxing them. Try to do about 8 to 10 repetitions, 1 to 2 times throughout the day to start improving the strength of your pelvic floor muscles even before you start the laboring process. A few modifications and safety things you should be aware of. Usually patients who are past 20 weeks avoid laying flat on your back. And the reason for that is, as the baby is growing, if they're putting a lot of pressure directly on your blood vessels, it can affect your circulation and how much blood goes back into your heart. Avoid any high impact exercises unless you're somebody who's used to doing high impact exercises or are fairly athletic. If there's ever any concerns, always a good idea to check in with your OBGYN to make sure you have the clearance before you engage in any kind of high impact exercise. exercises. Always, always, always listen to your body. If you do something and it hurts or it's pulling and making you uncomfortable, always hold back and reassess. Make sure to hydrate yourself both before doing any kind of exercises as well as after. And finally, and most importantly, if you're somebody who has placenta previa or any kind of placental abnormalities, absolutely necessary that you talk to your OBGYN before doing any kind of physical activities, because you're at a high risk for bleeding complications and you don't want to get into any kind of emergency situation. I always tell my patients that pregnancy is not a disability. It's just a new phase of your life. You can move, you can breathe, you can feel strong. You don't have to feel that your life is over or you're stopping doing all the activities you used to like just because you're pregnant. The 5 simple movements that we talked about today are so safe and so simple that anybody and pretty much everybody in pregnancy should be able to do them pretty safely. And not only will they help with how you feel during the pregnancy, they will also help you while you're laboring and also in the postpartum period. If you found this video helpful, then please put it in the comment section and let me know if you have tried some of these exercises and what you thought. In next week's video, I'm going to be talking about some postpartum exercises that you can do to help improve the strength of your pelvic floor and feel your strongest self. So don't forget to tune in and also click the notification button so you can be notified as soon as the video is uploaded. Hope to see you soon. Bye.